You're on.
Thank you. Thank you, Mr. Chairman, and thank you, members of the committee, for inviting me to testify today. I'm Joanne Cunningham. I'm the president of the Home Care Association of New York State, and we represent home care providers from every corner of New York State, urban, rural, suburban communities, from Long Island to Buffalo to the North Country. Today, I thought I would give you my written testimony, which includes actually 2 reports that HCA recently conducted. One is actually a plan of 3 ideas that are very simple that we would offer to you and that I will describe that talk about really what home care needs right now and ask for your engagement in helping us to accomplish that. That is called our 3-point plan to help home care providers make the transition to the mandatory managed care enrollment. The other report is actually a document that we've been doing for about 4 years, which is a report on the financial condition of the home care sector, which is also very telling right now, and I'll also describe to you some of the highlights. As far as my verbal comments, what I thought I would do first is tell you what's happening right now, and I would associate some of my comments to some of the points made earlier by Christy Johnston, by Jim Klein, as well as Dan Sisto. But right now, home care is undergoing a massive transition. I think that many would argue, and some of you on the podium would agree with me, that home care was perhaps the single most affected sector by the MRT redesign efforts. And just ticking off sort of the list of what home care has encountered as a result of the MRT in the past couple of years, about $1 billion in cuts and reimbursement, new mandates, including the wage parity law that you've heard, new OMIG mandates, which you've also heard described earlier, a new episodic payment system for the home care sector for shorter-term cases, the mandatory enrollment for pretty much everybody else, the elimination of the personal care program, a global cap, the closure of the long-term home health care program, and the intent to move those patients into managed long-term care, which hasn't happened yet because CMS has not yet granted the state the authority to close that program. And sort of the cream on the cake was lifting the certificate of need process and dramatically changing the landscape with respect to who can participate in the market. So in any one year, one of those things would probably have been a big deal. In one MRT process, we got all of those things. So what has happened as a result? Home care agencies, and this is all documented in the financial condition report, are struggling fiscally. Many are in fiscal jeopardy. About 80% of home care providers have negative operating margins, operating in the red. We've seen a dip from last year to this year of about 12% in just 1 year. We've also seen massive change and a lot of what I would call lack of understanding about how to participate in a new market. Since the MRT action a couple years ago, there's not really been that much attention to and focus on really the details and the roadmap for how you get a largely, almost exclusively, fee-for-service system into managed care. There's been little discussion about the continuity of care for patients and how you're going to map that out for the entire home care population. And really, there's been very, very little discussion of the need for regulatory relief that would essentially match a new regulatory structure to our new environment. There's also been a lack of focus on appropriate, what we call transition supports that would help home care move into a new system. So all of this has caused confusion, as well as closures. We've had long-term home health care programs close. We've had CHAs close. One of you had asked Senator DeFrancisco, I think, about county CHAs. I just wrote down the ones I could think of off the top of my head. Herkimer, Ontario, Livingston, Chenango, Madison County, all closed. That's the public health home care safety net in those regions. Another, half dozen are considering closure. This budget puts us in an additional precarious position because we have yet another $200 million in new cuts on the home care sector, which my colleagues from other organizations have talked about. We also have this global cap, which puts the healthcare sector and home care in particular in a real position of uncertainty and jeopardy. That all spells a lot of chaos in the home care delivery system. So for my remainder of time, I guess I would talk about, well, what do we need you to do and how can you help? Well, I think 3 things you can do would be very welcome and very much urgently needed this year. One is we need fiscal stability in the home care system. We need an end to the pile-on of cuts. We need an end to that fiscal uncertainty that is causing agencies to really not even have a strategic planning effort in their own agencies because they don't know what tomorrow brings. We also need some support, as Jim Klein indicated, for adequate rates for managed long-term care plans. If they don't get the rates they need, there's no way that the providers they contract with can also get what they need out of the reimbursement structure in their negotiations with plans. So we need there to be adequate payment for services. And remember, this is a very chronically ill, very vulnerable daily consumer of healthcare services population. So these are folks that are using healthcare services on a daily basis, and we need to assure that there are rates that are competitive enough to assure that folks can participate in this marketplace. The 2 other things we need are transition support. So how do we help agencies which are care coordination experts? These home care agencies have been dealing with chronic populations for decades. They know how to take care of very sick people in their homes. How do we enable them to transition to a managed care environment? And we've given you some ideas in our document, but these are things like matching, and Senator Hannan, you alluded to this, matching the assessment for the home care system, which is from a fee-for-service system to the managed care system. We have a very uneven system right now. How do we assure other transitions to make sure that the eligibility standards, the operating standards of these 2 systems that are now working together, how do we make sure that they can work together to the best of their capacity? And finally, and I guess I would put this in all capital letters, regulatory relief. Dan Sisto talked about the fact that we have made a massive change in the Medicaid program in New York State. We need a likewise massive change in the regulatory structure in our state. Without it, providers are hamstrung. They cannot effectively compete in this marketplace unless we get rid of a regulatory structure that matches an old world. Otherwise, it's an anchor, it's a ball and chain that providers have to drag around with them that if you're a health plan is not very attractive for you to contract with because you don't want to pay for that. And providers are paying for it because they have no choice, because they are locked into the regs from a prior decade. So we need those 3 things, and we would ask for the legislature's active engagement in helping us get them quickly. As Dan said, we got to be nimble. We got to be quicker than we ever have been if we are going to make this new Medicaid program work effectively and actually save the system dollars. Otherwise, we won't be successful in this redesign of our Medicaid program. And finally, and I'm just going to touch on these issues in my final minute here because you have all raised them at different points during the hearing. One is telehealth. The telehealth program was a priority of this legislature a few years ago. We have the nation's first Medicaid telehealth program. I get calls every day from other states saying, how did you do it? And I talk about the cost savings and readmission rates and others that have been yielded from our telehealth program. Without a transition for telehealth into a managed care environment, we face a cliff, because what we're doing is transitioning patients into managed long-term care, and their telehealth program through the old system goes away because MLTCs are not getting paid to provide that service. We need to do something about that. We also need to do something about the access issue and the fact that access in certain pockets of the state is drying up. As I mentioned, some of those county agencies were the lifeblood, were the safety net under the whole system in small communities and rural areas, and that's going away, and we got to do something about preserving that. And again, we also have to think very consciously about the pace of the transition for many areas of upstate New York, because it's not the same as in New York City. Thank you very much for the opportunity to testify today.